Hello everyone and welcome to the 4th Public Health Policy and Management Program under the umbrella of International Public Health Management Development Program by PGI MER Chandigarh, and this program is being hosted by Indian Technical and Economic Cooperation, Ministry of External Affairs, Government of India. I have with me very beautiful people here all over the world who have come here especially from their nations to learn something about health policy of India. So it's my privilege to have you guys here. So I would like you to introduce yourself, sir.
Thank you, Dr. Kritika. My name is Kayode Olaniyan. I'm from Nigeria. I represent the Nigerian Natural Medicine Development Agency.
So my question to you is that, is this your first time in India? And if it's your first time, have you ever attended such kind of program before?
Yes, this is my first time in India, and this program is actually very unique. Of course, I've attended a similar program in Europe, that's in Germany, but it's on a clinical research. Yes, that was 2017. But this for me is cool, it's good, it's great.
So you said it's unique. So why, how unique? Like explain, what did you find unique? Because you said you had been visiting to other programs, like you shared the experience of your 2017 visit. How is it unique?
Unique in the sense that the participants here, they are senior managers. So just like Professor Karma just remarked, all the participants here, you have something good to learn from them. Then another thing for me is the gamification. Games you introduced in between the sessions, they're very good and something I would like to take to my country to apply.
Great, absolutely great. He has already talked about gamification, so my next question would be to you, madam. Kindly introduce yourself, and I would like to ask you that he has just talked about gamification. So what is your experience over this mixed methodology which we are using? Yeah, you may take the mic.
Thank you very much, Dr. Kritika. My name is Gloria Guzani from Malawi. I am an environmental health officer from one of the biggest referral hospitals in Malawi, Kamu Central Hospital. The games, actually, they are very nice, they are good, and actually the mixture of the game, the yoga itself, I've never ever done this yoga before. It was my first time and it was funny, okay. So energetic. And the laughter was so extreme and it was so cool. Okay. Thank you.
Great. Thank you so much. We especially kept these activities to mix, you guys, because we know that everybody is from different culture. Everybody's learning process is different. So we try to inculcate such kind of activities to make it more, environment positive and easy learning is to be there. So I hope you all enjoyed the yoga and Bhangra session.
Yes, we did. Yeah. We did. Thank you
so much. Thank you. Over to you, ma'am. Please introduce yourself.
My name is Habimbola Oladedoyin from Nigeria, Nigerian Natural Medicine Development Agency. That's the research institute I work with.
Great. So we have reached to day 2 of this particular program. And if I ask you, when you go back from here, will you share this with your other friends that they should come to this program?
Yes.
And why so?
For example, the policy aspect of the teaching. It's an area that we are not explored to. But in this place, we've been exposed to that department, which I will share when I get back to my organization. Okay, great.
Yeah. Thank you so much. Yeah, ma'am, please introduce.
Hi, Dr. Kritika. Pleasure to be here. I'm Dr. Manohar Predashani, working as a consultant pediatrician in preventive and curative field. I'm from Sri Lanka. It's
Okay, great. Sri Lanka is like our
yeah,
sister country, I would
feel
say.
like same.
Yes, so it will be more contextual to you what we are teaching. So, what is your say on the contextual schedule which we have prepared? We are going to take you to field some best practices we'll be looking after, such as telemedicine, tele-evidence, which can be replicated in your country. What is your say on that?
Yeah, in our country, as a low middle income country, we are lacking of some. We are facing a lot of economic crisis in these days, and actually, we are not having much technical and telemedicine field. Actually, we are lacking of that. So this program and new learning techniques and new learning things we can apply to our country when I go back to our country, and yeah.
Great. Thank you so much. So over to you, ma'am.
Thank you.
Thank you.
Thank you, Dr. Kritika. So my name is Adeshida Janet. I'm from Nigeria. I'm representing National Biosafety Management Agency.
Okay,
Thank
so
you.
this is your first time in India?
Yes, this is my first time in India.
Okay, so have you ever attended such kind of program, similar program?
Okay, for me, I have not attended a similar program like this because especially in the policy study that we had today, we just developed a policy recently in my agency, and then we are at the implementation stage. So this program is actually apt for my agency.
Great. So what do you think is the USP of this program? Because like you said that your institution or the organization has recently developed a policy. So what is the USP which you're going to take back from here, and if you want to give some inputs to your organization?
Okay, so in the area of implementation, like Dr. Kama said, I'm going to cascade the process of accountability, like ministries or certain agencies should be held responsible for a particular thematic areas, because the policy has different thematic areas which is to be carried out by different agency, because the policy, like, we used a multidisciplinary approach,
Yes.
multi-sectoral approach to develop the policy.
Absolutely.
So I'm going to be cascading the accountability area to
That's great.
Yeah.
And she has talked of multicultural and multi-stakeholders and definitely that is very important for it, and I hope that your input will be really useful for your organization.
It will. Thank you.
Thank you so much. Hi.
Hello, Dr. Kritika. I'm very pleased to be here. My name is Cecilia Santamaria. I'm from Argentina. I've come a long way. So
Yes.
I'm very happy to be here.
We are happy to have you here too.
Thank you. And I'm a quality and process director at a city in Buenos Aires, which is the capital province of Argentina.
Great. We are so happy to have you all here. So my question is, like, in this particular cohort, we have 14 countries participating. And we know that we are trying to give you few scenarios, case studies, assignments. Do you find that this type of methodology is really useful for multicultural or multi-country people who are participating?
Yes, particularly so, because what I was amazed about today was that many of the problems you face in other countries are really similar to others.
Yes.
So some of the strategies you'll be trying to develop in your countries are replicable at our countries. So yes, I think it's particularly interesting because I've also done other type of programs that are similar in its content, but
Okay.
they didn't have this multicultural encounter. So this is one thing that I'm enjoying
Yes.
most of all.
Great. So I think it's the uniqueness which he also highlighted,
Yes.
that so many countries are coming together and talking on the issues and challenges which everybody is facing. So thank you so much.
Thank you.
So over to you, sir.
I'm Dr. Glovan Jalal from Kurdistan region of Iraq. I am Director General of Health in Erbil city, which is the capital city of Kurdistan region in Iraq. I'm so happy to be here with the friends and the colleagues and
Yes.
between different countries. So it is a good opportunity to participate in these kind of programs
Yes.
and to have networks and to learn more, especially this kind of course. Really, I see it is very interactive, and mostly it is student centered. So the participant is more interactive and prepare everything. So we are very happy for that.
Thank you so much. We agree with you. And this type of scenario, like today we are having an interview. So that one thing which you are sharing, I think it's reaching to millions who are going to watch this live, or giving that message across this. So my question to you is, like, you are at a senior position in your country, and this course is particularly at a policy level, and we know that policies are being framed at senior management positions. So how do you feel that this course will be beneficial when you go back to your country?
Yes, that's correct. Really, because of it is of public health policy, and for decision makers and the leaders, is very important to be participate in this kind of courses, because you can see what the problems of the other countries that they have.
Absolutely.
And who has more developed programs. So on base of that, we can develop and prepare more accurate policies to implement in our countries to develop and provide health for everybody.
Definitely, very well said. That, of course, when it comes to decision making, the perspective of everybody is very important. But ultimately, it is you who have to, think of keeping all the resources, the parameters, keeping in mind. So I hope that this program will be really useful to you, and we look forward to your action plan implementation. Thank you so much.
Thank you.
Over to you, Ma'am.
Good morning. My name is Omale Chinebu Olive. I'm from Nigeria National Medicine Development Agency in Nigeria.
Great, great. Let me tell you, Nigeria has been participating since the inception of this program and is a very active participants we see. So my question to you is, what do you feel about the unique selling point of this particular? How do you feel that it's unique?
It's amazing. In the area of public health awareness. And I learned another thing about leadership stream.
Okay.
That I will take it up and see how it goes.
Okay. So just to add upon, this program has been working from 2016, and we have trained around 1100 plus participants from 85 countries. And I definitely believe that we all will take at least something from these particular courses, though they are small. They are like a 1-week course, but we definitely hope that at least 1 or 2 learnings we are going to take back. So thank you everyone for joining, and it's a great time, and I hope you'll enjoy this program. Thank you. Very good, very good. Yay! Thank you guys.